Hello. All right. So in this little recording, we are going to talk about some test taking tips and strategies. The animals are coming out in force now. They were absent a second ago, but then they're like, oh, hey, you're going to record. Let's walk through 50 times. Um, See, here they come. Bless you. Anywho, we're going to talk about test taking tips and strategies. This is kind of a long presentation and I apologize, but hopefully it's pretty comprehensive in that it provides you with some good stuff that you can use on this. All right. So let me share my screen here. We are going to share PowerPoint and let's get this party started. Okay. So test taking tips and strategies, our presentation objectives, we are going to identify keywords and strategic phrases in NCLEX style questions. We are going to differentiate between positive and negative event stems. We are going to apply test taking strategies to eliminate distractors. We are going to talk about prioritizing nursing actions using frameworks such as ABCs, Maslow's hierarchy, and the nursing process. And then we are also going to learn how to hopefully help us to select the correct answers with greater accuracy by combining multiple test taking techniques. So that's the good news, is a lot of the techniques that we're going to talk about can be stacked and you can apply multiple techniques to a single question, which is helpful, right? So first, let's introduce some of the terminology here. I'm going to refer to these words quite a few times. So I just want to, oops, sorry about that. I was trying to click this and make sure. So I want to make sure that you're familiar with the terminology, before we get started and I start saying these things. So the first word that we're going to learn here is STEM. So STEM is actually the question itself. So sometimes, it's very straightforward. It's like, the drug loperamide does this. Or, it wouldn't say that. It would say, what does the drug, so it's a one sentence blah. Sometimes it paints this whole big scenario, right? Like, here's this patient, here's their medical history, here's their current vital signs, here's the assessment findings. So we can have very short and to the point stems, and we can have stems that are really setting the stage for a big scenario question, right? But the stem is the question itself. Right off the bat, I'm going to tell you one of the best things that I think that you can do is read that stem, read that question at least twice. Just make sure that you really understand what the question is asking you before you go and try to answer it. And some of the techniques that we are going to talk about today address that a little more specifically. So we'll talk about those as we go. Distractors are your plausible but incorrect options designed to challenge your reasoning. So that's where nursing exams get these kind of bad raps, right? And I mean, I'm not going to lie, rightfully so, because it is one of those tests where sometimes all of your answer options, including, your distractors, your correct answer, are going to be right. But we're looking for one that's the rightiest right, the correctiest correct. So there's not going to be a nursing test question. Well, sometimes there is, but that's like, what is 2 + 2? And your answers are going to be like 4, banana, square, and yellow. Because if we're going to make it that obvious, then why even ask the question, right? So our distractors are most of the time going to be plausible answers, which is tricky. And then we're going to have the correct answer, or really I should have said answers, right? Because we have those dreaded select all that apply. And we'll talk specifically about those at the end when I've introduced all the techniques. But I did kind of color code this example so you can see our yellow is our stem, our distractors are red, and then our correct answer is in green. And I don't do that throughout the whole thing, just on here so that you can see. I do highlight the correct answer on these other ones. So, all right, let's get into it. So the first technique we're going to talk about is really, I called it positive and negative event queries, but really this should be called like understanding what the heck the question is actually asking you. So Positive and negative event queries are NCLEX style questions that specify whether the nurse should do, that's positive, and you're going to hear me say polarity. So that's positive polarity or negative polarity. So questions that are positive, event questions of positive polarity, right? Or should not do. And so those are our negative events, our negative polarity. So recognizing the polarity of the question is critical for selecting the correct answer. So basically that's saying we have to understand what the question is asking us, right? So let's take a look a little bit more in detail at these positive event questions. So these ones are asking for the most correct, the most appropriate, or the best nursing action or statement. So in this one, we are looking for the rightiest right? the most correct answer. We're going to have maybe 4 correct answers, but we're looking for the most correct one. We're looking for the option that demonstrates correct nursing practice or knowledge. And then I have included a bunch of keywords and phrases. So best, best describes, appropriate, prioritizes, understands, and then nursing questions love to use indicates an understanding. And then I believe I even have that in the example, and we'll talk about how you'll see that one with a negative polarity too. So here's an example of a positive event question. So which statement by a nursing student indicates an understanding of proper hand washing? Now, remember, I just shared, we're going to read that question twice so that we know what it's asking us, right? So which statement by a nursing student indicates an understanding of proper hand washing? Okay, so now I'm like, I gotcha. You are looking for the correct answer here. So if we kind of look at each one of these distractors and, the correct answer that's down there as a true false, so I'm looking for a true statement. So I will scrub all surfaces of my hands for a minimum of 20 seconds. Looks like I can throw that one out because we all know every poster in the world that talks about proper hand washing says 20 seconds, right? So that's a false statement. I'm going to rule that one out. I will use a clean, dry paper towel to turn off the faucet. That checks. I will turn off the faucet only after I put on clean gloves. Well, no, because then I'm going to contaminate my clean gloves, when I touch that yucky faucet. So that's a false statement. I don't like it. I will only wash my hands when they are visibly soiled. Ooh, also false, right? Because we can't see viruses and bacteria and all of that stuff, but they're there. So when I look at these, there's only really one true answer here, right? And that is I will use a clean, dry paper towel to turn off the faucet. Da-da-da-da, we got that one right. All right, so now the opposite of that is we have negative event questions. So these ones are tricky. Sorry, my dogs are barking. So it is asking you for the incorrect, the contraindicated, the unsafe, or the least appropriate nursing action or statement. Why these trip people up is because it is ingrained in our brains to answer the question correctly. So now the correct answer is an incorrect action, if that makes sense. So it gets a little weird, right? And we'll take a look at that here in just a second. So in this case, the correct answer is the option that reflects what the nurse should not do. So we're looking for the falsiest false answer, right? So the keywords and phrases, not, never, there are a whole bunch of negative words here. Here's where we see that indicates a need, right? So we saw in the positive polarity, we had indicates an understanding. Now all of a sudden we have indicates a need for further understanding, further teaching, further instruction. So anytime we see that further, you can think to yourself like, oh, the F and further, F for false, right? So I'm looking for the false option here. Let's take a look at the example question. So, and I would tell you too, if you have a question that is more than one sentence long, this is something that worked for me was I just got in the habit of reading the last sentence first. So which of the following client statements indicates a need for further teaching? Ooh, so I have an indicates a need, which means I have a negative polarity question and I'm going to be looking for a false answer. So now let's go back and read the whole thing. A nurse is providing discharge teaching to a client prescribed furosemide. Which of the following client statements indicates a need for further teaching? Okay, so what I'm going to be looking for here is my client to say a false statement about furosemide. So the other thing too that I would encourage you to do is try to answer the question in your head before you even look at the answer options, because that way when the answer option is there, then you're like, oh, sweet, that's what I was thinking, right? In this case, that's a little trickier just because we're looking for a false statement, but we can still kind of work our brain around it. Like, okay, what do I know about furosemide? You know, blah, blah, blah. So now I'm going to be looking for something that is, false about furosemide. Okay, I will weigh myself every morning before breakfast. That's good. That's good discharge teaching right there, right? I'll try to eat more foods like bananas and potatoes. I also like that teaching because sometimes furosemide can deplete your potassium. I will take my medication with a large glass of water. Sure, because we're gonna pee a lot when we're on furosemide. D, I'll stop taking my medication if my legs stop swelling. Ooh, I don't like that because if you stop taking your medication, then your legs are going to swell again, right? So that's my false option there, right? All the other three options were good things to hear my patient say. Those three ones indicated my patient understood, whereas this one says I got to go back and do some reteaching here because we don't have a good understanding of this. All right. So technique number 2, this is, and you'll see the polarity is something that we can oftentimes stack with other techniques. So, and we'll see that, throughout my examples here. So technique number 2 is prioritization. So in this case, we're looking for, this is another option or another question type where we're going to have more than one correct answer potentially, right? So it's looking for what should we do first? What's the most important thing we can do? What of these answer options has the highest priority? So again, this is an example where all of our answers could be correct, but we're looking at an answer option that addresses immediate safety needs, addresses anything that's life-threatening, or critical steps in the nursing process. And we're going to talk more about the nursing process in just a few minutes. So this is, again, one of those things where, man, we're going to have maybe more than one answer, but let's look at the best option here. Here are some strategic words for your prioritization questions. And let's now, so sorry, I said now let's, and then I accidentally hit the next button. Okay, sorry. So let's spend just a second on this. One of the things we're probably going to see best a lot, and then you're going to see like, I feel like initial, best, and you'll also see these prioritization questions written as like, as positive polarity. It'll say like, the nurse best demonstrates understanding of this when blah, 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 blah. So that's kind of how we see right away, like, okay, I can start stacking this because this is a positive polarity question and I'm looking for the highest priority within that positive polarity. So not only am I looking for the rightest right answer, but I'm also looking for the rightest right that should be done first. Ugh, nursing tests, man. So now I'm going to give you a couple of strategies to help if you're like, I don't know the answer to this question, because you know what, that's okay. And we're gonna have questions that we don't know the answer to. And I mean, and that goes for all of us, right? So I mean, I still sometimes when I'm, looking through prep views and looking through things, I'm like, oh, I don't know the answer to that. But here's some things when we just flat are not sure of the content. These things can help us to eliminate distractors and make the best choice, right? So our strategies for answering prioritization questions, ABCs, and I'm going to explain each of these individually, Maslow's hierarchy of needs, and the nursing process. The nursing process is this crazy image that you're seeing here with like all these layers. But really, we're going to focus on that very bottom part, the assessment, analysis, planning, implementation, and evaluation. So I'll get you guys there in just a minute. All right. So our first, like if we get to this question that we're like, I don't know the answer to this. The very first thing we can do is this an ABC question? So ABC's not the alphabet in this case, it's airway, breathing, and circulation. So this is our priority in most situational questions, you know, when we have like a question that's asking us about an unstable patient, right? So first thing, is the airway open and clear? Is the patient breathing effectively? And then our C, circulation, is the blood and oxygen moving through the body? So if I have a patient who is choking, right? If they are in respiratory arrest, they're not breathing, and I start giving them rescue breaths, that's not going to do a thing for them if their airway isn't open and clear. So first we have to establish that airway, right? Then we can worry about the breathing. And then because we hopefully have oxygen stores in our blood, we've still got, you know, and we still have a pulse, right? We still have oxygen and blood circulating the body. So that's why we have that order of airway, breathing, circulation. So let's look at an example of this question. And you're going to see they're not always super obvious, right? And so with my example question, you'll see that right away. A postoperative patient is receiving morphine for pain. The nurse should prioritize which of the following actions in providing care for the patient. All right, so the nurse should prioritize which of the following actions. So we are looking for a correct thing to do here, right? Now, maybe I don't know the answer to this question because maybe I don't know that much about morphine or I don't know that much about post-op patients. Let's look at this and see how we can use this prioritization, you know, hint to help us answer this question. So my first option, monitor stools. My second option, monitor urine input. My third option, encourage fluid intake. And then my fourth option, encourage coughing and deep breathing exercises. Well, all of these seem like right answers to me, and they are all right answers. But we can only pick one here because this isn't a select all that apply. So how are we going to prioritize these? Well, monitoring stools is really important. You know, that tells me that, you know, the GI system is waking up after surgery and all of that stuff. Monitoring urine output, that's even more important to me, right? Because that tells me about the kidneys. Encourage fluid intake. Good. Yes, I want that thing. I want that to happen. But this last one, encourage coughing and deep breathing exercises. Well, that one's tied to my airway, right? Because we want to keep a clear and open airway. We want the lungs to be, you know, free of pneumonia, free of atelectasis, any post-op complications. So because this one ties back to my ABCs, my airway, breathing, circulation, even if I was like, I don't actually know, we can rule out those other ones because they're just not going to take priority, right? So we're going to go with that option. All right. Now that you have that in your head, I'm going to undo it because we have an ABC exception, and that is with CPR. So in a question scenario where I mentioned respiratory arrest, if we have cardiac arrest, if we have somebody who is pulseless, now the order changes. So we go from ABC, airway, breathing, circulation, to now CAB, which is circulation, airway, breathing. Why? Well, because in cardiac arrest, you know, we have that circulation stopping immediately, but oxygen, you know, it's remaining in the blood for a short period of time. We want to start with chest compressions because we want that oxygenated blood that's still hanging out in there to perfuse those tissues. So we want to make sure that we have good, you know, as good as we can of circulation still going to the brain. It's still going to the heart because, you know, that is what's going to save their life, right? So once we have good effective compressions, then the next thing we're going to do is worry about that airway, and then we're going to do rescue breathing for our patient, right? So here's an example where we have the circulation, airway, breathing focus. A nurse enters a patient room and finds an adult lying on the floor, unresponsive, not breathing, and without a pulse. After calling for help and activating the emergency response system, what should the nurse do next? Okay, so we've got that keyword next there, so we know this is a prioritization. Now, if I went airway, breathing, and circulation, I would be tempted to put A, right? Perform a head tilt chin lift to open the airway because airway, right? Begin chest compressions, place the patient in the recovery position, or apply the AED pads and wait for analysis. But no, because I have in my stem that the patient does not have a pulse, I need to switch the order of operations. And the very first thing I'm going to do is option B, right? Begin those chest compressions. All right. So now let's say in our questions, there's not a ABC issue, right? There's, nobody's not breathing. We don't have respiratory arrest. We don't have cardiac arrest. There's no, distractors or anything that have anything to do with airway. Well, how in the heck can I answer these questions now if I don't have a clue what the question is asking me? So when we have no immediate ABC or CAB issue present, now we can have Maslow's to help us, right? So Maslow's, hopefully we remember from our prereq, work with psych and everything. We have this hierarchy of needs, right? And the higher we go up on the pyramid, the more, or actually, let me say that differently. The lower we are on the pyramid, the more basic the need is, right? So we have our physiologic needs, then safety and security, then our love and belonging, self-esteem, and then our self-actualization needs. So, and it basically, concludes, that's a strong word, but it states that we really can't meet those higher level needs until our lower level needs are addressed, which makes sense, right? Because those are physiological needs. So if I do not have oxygen, I probably don't care about my self-esteem too much, right? If I don't have, if I'm outside in, if I'm an unhoused individual who lives outside in Phoenix in the summer, sure, we still have those self-esteem, but as far as like the criticalness of answering like a prioritization question, we're probably going to be more concerned about body temp, about shelter than we are, self-actualization needs, right? So this is just another way to look at these. So when I start thinking about how am I going to answer these questions, think about where it is on Maslow's. So here's our example. A patient is angry about not being able to perform activities of daily living without help. So activities of daily living are things like, transferring yourself from your bed to your wheelchair, or it doesn't even have to be that basic. It could be, can I get up and walk to the bathroom, right? Can I dress myself? Can I brush my teeth? All of those things, right? So they can't do those things without help. What should the nurse do to best reduce the patient's anger? All right, so we're not going to have an ABC or CAB option here, right? This is about those patient-centered needs, things like that. So disregarding the behavior, well, that's not going to work. Offer choices about care, set firm limits on the behavior, encourage recognition of limitations. So now we're thinking about, all right, where is this going to go on Maslow's? This is probably going to be self-esteem, right? And what are the things that I can do to empower my patient? Well, I can offer choices about care, right? Because those other things are kind of, more limiting, right? So we're going to look for the things that promote, oh my gosh, I just forgot the word for it. Promote something, that promote a word that is one of our main 4 words. We've got non-malfeasance, beneficence, autonomy. Holy moly, there we go. All right, that promote autonomy for our patient. Okay, so last but not least, if we're like, I don't know how to answer this question, now we can depend on our old pal, the nursing process, right? So when ABCs don't apply, when Maslow's is no good to us, one of the things that we can do is use the order of the nursing process to help us guide priority decisions. So when we think about the nursing process, we start with assess, then we move on to analyze. So I'm assessing my patient's condition. I'm analyzing, what does this mean, and then I got to come up with a plan. Is there something I can do? Is there a medication I can give? Is there a non-pharmacologic, pain relief thing I can use, like an ice pack? Is there discharge teaching that I can do? Whatever my plan is. Well, then I need to implement that plan, and then I need to evaluate the effectiveness of it. So When we have questions that we're like, okay, I can't use Maslow's, I can't use ABCs. Now let's see, is this a nursing process question? So if we still have an option in our distractors and in our correct answer where we're still assessing, that's probably going to be our right answer. If we have a bunch of evaluation options, but there's a planning option, maybe we're still planning, you know? So let's look at an example of this. A client complains of pain and swelling in their right calf. What action should the nurse take first? Okay, so knowing what we know about the nursing process, elevate the client's leg on 2 pillows. That's an intervention. So we've got an intervention. We're almost at the end of the nursing process. Document the findings in the client's medical record. Documentation is not really technically part of the nursing process. It's just a necessary evil, right? Medicate the client for pain with an opioid analgesic. I like it, but that's an intervention. So let's see if where this last one lives. So check for skin color, edema, and pedal pulses. Ooh, so we're still assessing in that step. So that is our very first step of the nursing, or I'm sorry, in that answer option. So that's the very first step of the nursing process. So because there's still assessment that can be done and should be done before we, you know, throw opioids at it or elevate the leg or, you know, whatever it is. There's still assessments that we can do to try to figure out what's causing this pain. So let's go ahead and select that one as the correct answer. All right, technique number 3 is spot the clang. I do feel like the rest of these techniques go a lot faster. Those first 2 have a lot to them. So with this one, we're looking for the clang association. And a clang is a word or phrase that's in the stem that we see again in the option. So the whole thing is like the sound of a ringing bell, you know, it's like we hear it again. So clangs can be either obvious or obscure. And oftentimes an option with the clang is the correct answer. These are a little like curious. So I wouldn't get too hung up on, well, is this obvious or is this obscure? Because you'll find that even the obvious one is a little bit obscure. So let's take a look here. So a nurse is assisting a client to ambulate in the hallway, ambulate, walk, right? So the client suddenly becomes weak and starts to fall. What is the best action by the nurse? So let's break this down for a second. What is the best action by the nurse? So this is a positive polarity question. And we're looking for the correct answer here. So grab the client under the arms and pull them upright. Sounds like a way to get hurt and to hurt the client. Lower the client to the floor while protecting their head. I kind of like that. Leave the client to get help. We'll stick a pin in that. Try to hold the client upright until help arrives. Also sounds like we're both going to get hurt in that. All right, let's look for the clang, right? So in here we have starts to fall. Sometimes clangs are not a specific word, but they're an idea, right? So when we think of falling, we think of we were standing upright and now we're not. So to me, the idea of falling is we're going to end up on the floor, right? So lower the client to the floor. This is our clang idea here, right? Or our clanged concept, because we have a client who's falling. So now in this case, if I'm really not sure how to answer this, I can look for the clang, right? I can say, oh God, I don't know. Would I leave the client and get help? Probably not, right? But this lower the client, oh yeah, to the floor, because that's basically what a fall is, right? So in this case, we have those ideas being the same. All right, so this one is the obscure example. And this is, it's actually very similar to the obvious example in the sense that, or I don't know, actually, maybe I should have flipped these two. Maybe I did. Maybe I just labeled these wrong. I don't know. Anyways, but like I said, don't get too caught up on, is this obscure or is this obvious? So a nurse is caring for a client who reports shortness of breath when lying flat. Which statement by the client suggests orthopnea? So in this case, you know, you might read this and be like, I don't know what the heck orthopnea is, but we're going to learn a lot of medical terminology. And then we're going to learn that PNEA actually means breathing, right? So that makes sense because the rest of my stem, it says who report shortness of breath when lying flat. So which statement so orthopnea is probably shortness of breath when lying flat, right? Because it seems weird that they would say, like, a nurse is caring for a client who reports shortness of breath when lying flat, which statement by the client suggests hypertension. Like, we're not going to ask on blood pressure when we've already given you that, right? So, okay, that's my first clue, is I'm looking for something respiratory wise, right? Or like position, right? So I have to sleep sitting up in a chair. Oh, all right. So they have shortness of breath when they're lying flat. So I kind of like that one, right? Because they're telling me I have to sleep sitting up in a chair. I wake up at night to urinate. Well, that doesn't have anything to do with breathing. I get dizzy when I stand quickly. Also not so much breathing. My ankles swell by the end of the day. That's kind of more circulation, right? So in this one, we basically have clang, 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 because we have a shortness of breath while lying flat is orthopnea. And then we have this concept of the person has to sleep sitting up in the chair because they get short of breath when they lie flat. So I don't know, I guess maybe it is. There, it's, don't get too caught up on the obscure, but that's what the clang is do I have something in my answer options that basically repeats itself? All right, technique number 4, identifying the central person in the scenario. Most of the questions focus on the patient, and we're going to talk more about that in a second. So sometimes the focus is on somebody else, right? So we have to figure out, like, what's the subject here? So it could be a family member, a caregiver, another healthcare provider. So what we need to do is ask ourselves, who is receiving the care or the intervention, because it would make sense that our distractors, our correct option, is going to tie back to the subject of the question, right? So let's look at an example of this. So a nurse observes another nurse treating a patient in an abusive manner. What should the nurse do first? So that's a positive polarity question, right? So we're looking for a correct answer. Tell the charge nurse and write a report. All right. So when I think about this question, a nurse observes another nurse treating a patient. We've got a couple of subjects, right? We've got the nurse who's observing the nurse, we've got the naughty nurse, and we have the patient. Now, remember, most of the time they're going to be patient-centered, but I do have a couple of people. I don't have anything in that stem that talks about the charge nurse, so I don't love that one. Let's keep going. Become a role model for the nurse. That seems like it's going to take a lot of time, right? And it kind of puts me or that first nurse as the focus. Talk with the nurse about the event. Okay, maybe. But then our last option, reassure and calm the patient. Okay, so we have the hint when we've got multiple subjects and one of them could be the patient. That's probably going to be your best bet, right? So reassure and calm the patient. That's the very first thing I'm going to do because that's the most patient-centered response. All right, now what if we have a different situation? So let's do another example of this, but this time where the central person is not the nurse, right? Or I'm sorry, is not the patient. So a nurse is orienting a new unlicensed assistive personnel, UAP, that's what NCLEX calls them, on proper infection control. Which statement by the nurse indicates a need for further teaching? Ooh, so we have ourselves a negative polarity question here, right? Because we have indicates a need for further teaching. So right away, I need to reverse my thinking and remind myself that I am looking for a false answer, okay? All right, I will wash my hands before and after patient contact. That seems like a true thing. I will wear gloves when we're providing oral care to a patient. I hope so. I will recap used needles when placing them in the sharps container. I don't think we should be recapping used needles, so that seems false. I will place a mask on the patient who is coughing before transporting them. That seems like a true. And we're going to be tempted to pick this one because one, it says patient, and we're like, oh, that's the only one with the patient, right? But in this case, the which statement by the UAP, so it's giving us that hint that the UAP is one, the central focus, and then the second hint indicates a need for further teaching is that we're looking for a false statement. So we are looking for a false statement made by that UAP, and the correct option then, because it's incorrect, is option C. There you go, clear as mud. Technique number 5, choose patient-centered care. So very similar to technique number 4, right? But in technique number 4, we were making sure that we understood who the subject of the question is. Now, in this one, we have the understanding that the patient is the focus, but I want to make sure that not only are they the focus of the question, but that I'm choosing the option that is going to empower that patient. So when we talk about nursing values and things, this was the word I couldn't remember earlier, advocacy, non-malfeasance, beneficence. We are looking for the things that do no harm, that promote independence, that are in the best interest of the patient, right? So when we are not real sure about which answer to pick, I want to pick the one that best does all of those things for my patients, right? So it's going to keep the focus on the patient's needs, values, and goals. It's going to offer choices. It's going to empower that patient, to participate in their care. It's going to be the answer options that help us to identify that patient's preferences. And also, NCLEX, HESI, they all love question options that get your patients talking. So before we answer these questions, we want to ask ourselves, does this option put the patient at the center of the decision or conversation? So let's look at an example here. A patient recovering from surgery says, I'm nervous about going home tomorrow because I'm not sure I can take care of myself yet. Which response by the nurse is most patient-centered? So with this one, positive polarity, we're looking for a true statement. Maybe, I don't know, maybe we're like, well, maybe there will be an obviously false one, but if there's not, then our clue here is what's going to most put this patient, empowered, that they felt heard, all those things. So you'll be fine once you get home and rest. Well, I don't know that my patient felt very heard with that response, right? Tell me more about the specific concerns you have. I kind of like that one. Let's come back to it. Your doctor wouldn't discharge you if you weren't ready. I don't love that one because it doesn't really get my patient talking. It makes them feel like I'm like, yeah, you're good to go. Your doctor wouldn't discharge you, right? We'll have physical therapy work with you before you leave. That's good, right? But what if that's not what the patient's concerns are about? What if it's, like, I don't know that I'll be able to go pick up my prescriptions, and, something that physical therapy has no role in, right? So when we look at these, option B is what is going to allow us to, explore those patients, that patient's feelings, right? So that is going to be our best option here. All right, technique number 6. Watch for your shutdown responses. So we want to make sure that we are avoiding answers that ignore, minimize, or invalidate what the patient is feeling. These are the ones that kind of like that other one, you'll be fine, right? The doctor wouldn't discharge you, blah, blah, blah. Those ones that just kind of shut the patient down and are like, I don't want to listen to you anymore, right? I got other things to do. So supportive nursing responses acknowledge feelings and encourage communication. If the response has, don't worry, you'll be fine, it's almost over, that's probably wrong, except, in the case of it being a negative polarity question. All right, so our shutdown response example. While transferring a patient from bed to wheelchair with a mechanical lift, the patient begins to panic and scream. What is the nurse's best action? So option A, quickly continue and say, it's almost over. B, immediately lower the patient back on the bed. C, say relax and slowly continue with the transfer. Or D, stop the lift from rising until the patient regains control. All right, so quickly continue and say it's almost over. That did not validate my patient's feelings. That did nothing except maybe make them not trust me very much, right? I like B because in this, by us immediately lowering the patient back to the bed, we have acknowledged that the patient, is extremely uncomfortable with what's happening. So I like that one. Stay relaxed and slowly continue with the transfer. Probably not so good because we've kind of discredited what our patient has said. We've shut them down, right? And then option D is stop the lift from rising, which might be a tempting one to answer because it's like, let me just stop, right? And let this person calm down. But In this case, if they're suspended in the air and I've just got them hanging there, I may, that might not be a good place, right? So remember, we're wanting to empower the patient. The patient has the option of not being transferred with a lift, right? So we are going to go with B. We are going to put that patient back in control, right? We're immediately lowering them down, and then we're going from there. All right, technique 7, watch for absolutes. So identify words that are absolute. Absolutes are words that are black and white, basically, right? So our keyword examples on this: just, only, none, never, all, every, always. So in the world of nursing, we have very few absolutes. Oh, I'm so sorry. Everything kind of lives in a gray area, right? There are likely exceptions to most things. So options with absolutes are a lot of times incorrect. Not always. So we do have to use clinical judgment, but it might help us to eliminate a possible distractor if we're not sure, right? So let's take a look at this. A nurse is teaching a patient about insulin administration. Which statement by the patient indicates a need for further teaching? Ooh, so we have a negative polarity, right? Because we have indicates a need for further teaching. So we are looking for a false statement. I will always use the same injection site. Oh, well, we've got ourselves a pretty concrete word there with always, right? But I'm looking for a false. So is that the right answer? Let's take a look. I will rotate my injection sites to prevent lipodystrophy. Yeah, that sounds good. I will store unopened insulin in the refrigerator. Also sounds good. I will check my blood sugar before administering insulin. Also sounds good. So in this case, we're looking for that false statement, remember, because it's negative polarity. And not only is it our only false statement, but it's got that concrete absolutism in there to help us really be confident with that being our correct wrong answer. Or is it our wrong correct answer? I don't know. All right, in this case, we have an absolute in the stem, and that's pretty tricky, right? Because now we have to make sure that our answer options do tie back to that. So now we know we're looking for something pretty black and white. So which nursing intervention should always be implemented for a patient receiving oxygen therapy? So now with this, because my absolute is in the stem, I know that I'm going to be looking for a pretty concrete black and white answer here. I'm so sorry. I got the yawns. All right. So encourage the patient to cough and deep breathe every hour. That's good advice, but is it always? Is that concrete black and white good advice? Well, no, because what if my patient can't follow commands, or what if they're intubated or whatever, right? So no, that one we've got room for gray. Secure the oxygen delivery device in place. I do like that one. C, remove the device for at least 10 minutes each shift to prevent skin breakdown. This is another area where that doesn't sound like good advice, right? Because if we have somebody who is ventilator dependent, if I shut down that vent for 10 minutes, they have no airway, they have no breathing, right? So that does not seem like a black and white thing to do. That seems like lawsuits. Provide humidification regardless of oxygen flow rate. Well, we're going to learn in lab that we can't actually turn on or add humidity to anything less than 2 liters of oxygen a minute. So that's not so black and white. Let's go back to B then. Secure the oxygen delivery device in place. Well, yeah, that makes sense, because if we have a nasal cannula, then we, put it behind our patient's ears, and then we tighten it under their chin. If they have a trach, we hold it in place with a trach collar. If they have a mask on, there's a strap that goes around their head. If they have an endotracheal tube, we tape it. All right, yeah, so that one seems pretty black and white, right? We're always going to hold that oxygen delivery device in place. Otherwise, who knows, if it's in the right spot or not, and if it's doing what it's intended to do. So that's an example of how it could be in the stem and would then therefore require a very black and white answer. Well, I forgot to give you guys a correct on that one, but it's B. All right. Oh, look at this. For some reason, I did 2 of these. I felt really strongly. So which action should a nurse never take when performing patient care? So again, we have STEM, or I'm sorry, a concrete example in our STEM. So we are looking for a never a thing to do. We should not wash our hands before and after. No, we probably should do that. We should not dispose of used sharps in a puncture. No, that seems like something we should do. We should not leave the bed in a high position with the side rails down. That seems pretty true. We should not identify the patient using two. Oh, all right. I know I should do A, B, and D, so I'm going to go with C being the thing that is very black and white for me too. I should never perform this action, right? All right, technique number 8, look for opposites. So opposites are 2 answer options that reflect extremes of the same concept or action. So often one of those opposites is correct. So, right off the bat, like a silly example of that is, if I said, when when the light at a traffic light turns green, you should do stop or go, right? Because those are opposite and they can't both be right. So if we have opposites available to us, if I had, stop, go, and twirl in circles, I can probably rule out twirl in circles because 1, it's silly, and 2, we've got these 2 opposites here. So if I've got those opposites that are living in my distractors and in my correct answer options, a lot of times we can say, okay, that's probably going to be right because we do have those, one end of the, I don't even know what I'm trying to say. Let's just keep going. All right. So this happens when the question is testing a clear right and wrong action or principle. So we want to compare those opposites first. One may stand out as a safer, more appropriate, or more aligned with the question stem. Now you'll see in this case, the question that I chose is pretty just, this is a concept or, this is related to a skill. There's only one right answer here. So the student nurse is donning a pair of sterile gloves. The student nurse demonstrates understanding of this skill, positive polarity, right? So we're looking for the right to answer here. When they glove which hand first? So I've actually got a whole bunch of opposites here. We've got right hand and left hand. I was trying to think of which way it's right and left for you guys on the video. Anyways, this is my right hand and left hand. And then we have dominant hand and non-dominant hand. So you might get to this and you're like, oh, dang, I don't know. But if I've got these things, well, I know not everyone is right-handed, so that can't always be the correct answer. Not everyone is left-handed, so that can't always be the correct answer. But everybody has a dominant hand and a non-dominant hand. Of course, the caveat, if somebody is truly ambidextrous, in which case, I don't know, then it's preference, right? But according to our skills list, we are going to glove that dominant hand first. So because that is the correct answer, we can rule out our other opposite, and our correct answer is dominant hand. Okay, so technique number 9, eliminate equally plausible options. So sometimes we have 2 options that are so similar that neither one is better than the other. And if they both fit the stem equally well, then they're probably both wrong. So this is one of those cases too, where it's like, I may not know the answer. So I'm just looking at how can I best eliminate distractors, and this is a really good technique to use for that. So if I can eliminate 2 things because they're very similar, then that leaves me to a 50-50 guess instead of a 25% guess, right? So let's look at an example of that. All right, before giving a medication that is, I don't know why would I pick a word that I don't know how to pronounce? Teratogenic. That's what I'm going to go with. And basically that means harmful to a fetus. So before giving a medication that is harmful, potentially harmful to a fetus, which question is most important for the nurse to ask? Have you ever had an anaphylactic reaction? Okay, so when I think about anaphylaxis, I think about allergic reactions. B, were you ever addicted to drugs? Okay. C, do you have any allergies? And D, are you pregnant? All right, so to me, C and A are similar, right? Because they both pertain to allergies. Because they are both plausibly like, okay, sure, let's rule them both out, right? So now we can narrow down to, have you ever, were you ever addicted to drugs, or are you pregnant? Well, I know that, ever addicted to drugs doesn't have anything to do with a fetus. So we're going to go with, are you pregnant? Because that's what's going to help me, figure out whether this is potentially going to harm this person's baby. All right. So technique number 10, find the unique option. So now on this one, we might have 3 options that are similar or address the same concept, and then a different option that's going to stand out. And that one might be correct, right? So with this one, we're going to use this technique after we've ruled out more direct strategies. So ABC, safety, things like that. And one of the things is that with this type of, sorry, I keep rolling myself backwards. With this approach is maybe we can look for like the differences in somebody's scope of practice, or, how specific is this question being? What are they actually looking for? So let's look at the example here. A nurse is providing preoperative teaching to a patient scheduled for surgery. Which action best ensures the patient understands the teaching? Excuse me. So use simple vocabulary. I like it. Ask the patient what was learned. I like that. Speak distinctly when giving directions. Okay. Speak slowly when talking with the patient. Well, that doesn't, there's nothing in the stem that suggests I need to speak slowly, but I have all of these options here, A, C, and D, that all have to do with speaking. But let's stack our techniques here. Asking the patient what was learned, not only is that the only one that stands out as not related to me talking, but it's also patient-centered and it promotes patient autonomy. All right. So I like option B for all those reasons. Good, good, good. All right. Technique number 11, find the umbrella answer. So this is like a global statement, meaning, the global is the umbrella statement where it can kind of fit all the other options underneath it, right? So when the question asks for best or most comprehensive action, the global option is often correct, right? So that might, a silly example of that is if you said, I'm not even going to go silly. I'll just go to the question. But in this case too, we're going to have things that now, of course, I feel like, well, I better explain it. But I was thinking of, which of the following food choices would be appropriate for a vegetarian? Tomato, well, I don't know. Now I've already, let me take tomato off. Watermelon, strawberries, bacon, or fruit. Well, watermelon would be okay, and strawberries would be okay. Bacon, not so much. But fruit is, the umbrella that both of those things fit under. So there you go. I don't know why I felt really compelled to tell you that when I could just use this example here, but I had to talk about fruit. All right, so a nurse is developing a plan of care for a patient with limited mobility. Which intervention best addresses the patient's needs? Okay, so what do I know about this person? They have limited mobility. I'm looking for a positive polarity, a true answer. So performs range of motion exercises twice daily. Seems good. Turn and reposition the patient every 2 hours. Also seems good. I've got a problem here because so far I have 2 that look good to me. Encourage the patient to sit in a chair for meals. Oh man, but that also looks good. And then I have here D, and this is a terrible question. I would never put this on my test, but promote mobility. Because all 3 of those other options actually work to promote mobility. I would never include a question this, bad on my test, because not only this, where we have this umbrella, but also look at the length. That's another little trick for you guys too, is sometimes if you have one that's exceptionally longer or exceptionally shorter than your other answer options, that might be a correct answer. But I try to be a little bit mindful of that when I'm writing a test. All right, technique number 12, use duplicate facts to your advantage. So sometimes we have questions that are multiple questions, all rolled into one, right? So we have two facts that are paired together. And if you can identify one of those facts as correct or incorrect, then you can eliminate two options at once, giving you that 50-50 choice. So this is really good for when you have a really content heavy question, but you recognize one part of it immediately. So let's look at an example of that. A nurse is monitoring a patient with respiratory problem for the presence of cyanosis. So that's going to be that bluish tinted, bluish tinge skin. What are the most appropriate sites to assess? Okay, so again, I kind of like to sometimes answer these before I look at the options. So when I think about where do I see cyanosis first, I tend to see it centrally first before peripherally. So I'll see it, people's lips turn blue. We do see it out on the hands. But okay, so I know that when I think about cyanosis, I think about blue lips. So even if I know nothing else, let's go into answering this with this. And I'm actually going to go ahead and, well, no, I'm not. I'm going to stay here. All right, lower legs. I don't know about lower legs, but I do know about around the mouth. So maybe A is a possibility. Around the mouth, yes. And the fingernail beds. I'm not sure about the fingernail beds, but I do feel pretty good about this around the mouth. Conjunctiva of the eyes. No, that seems wrong. And the lower legs. Well, I wasn't sure about the lower legs up here, but I know the conjunctiva is wrong. So if this one's wrong, then probably this one has to be wrong too. And on this one, finger bed nails, I also maybe wasn't sure about finger bed nails, but I felt pretty strongly that I'm not going to see cyanosis in the conjunctiva of the eyes. And because that one is here, then that's going to be wrong, right? Because I'm pretty sure about that one. So even if I don't know for sure if I can see this in fingernail beds, I know for more sure that I can rule out these other ones because they are paired with an incorrect fact. So, and then when I did the answer key on this one, I put the green is correct answers and then red is incorrect. So you can see how, they're paired and stuff. So this is a very helpful hint if you're like, oh my gosh, I don't know, but at least you know part of it, right? All right, so that pretty much recaps the 12 test taking techniques. Remember that they can be stacked, especially, identifying whether it's a negative or a positive polarity question, the prioritization, all of those things, they can be stacked, right? And we can use them together. So now let's just talk about a few more things and then we'll wrap this sucker up because there's a long presentation here. So we can't talk about nursing tips and strategies without talking about our dreaded select all that apply. So SATA is the abbreviation, or that's what we say sometimes, which is select all that apply. So when we are answering select all that apply questions, we need to keep it in our brains that each one of the answer options that we're looking at is its very own true false question, right? So then we can evaluate them one at a time, because remember, there's not going to be a pattern in those correct answers. There probably isn't going to be. So I don't need to compare them to each other. I only need to compare them to the stem, right? So the other thing too, keep in mind that in this case, we might be looking for a black and white option, right? Because we're going to be asking ourselves, would I do this for every patient in this situation? We also want to eliminate obviously incorrect statements. You can use the opposite ones, look for those polar opposites to help you with that too. And one of the things, visualize the scenario before deciding. What's nice, and I can't believe I'm going to say this, but what's nice about select all that apply is it gives you the option to choose more than one right answer, right? So I don't know if this is still the case, but last I heard the NCLEX was using up to 8 answer options with that. It's no longer an all or none. It's now plus minus. So let's say there are, 8 possible answers and 3 of them are correct. You're not going to get a 0 anymore on a question if you answer, 4 of them correct, you would get plus minus. So you're going to get credit for the 3 you answered correct, but then you're going to get some of that credit subtracted when you answer an incorrect option. So let's see here. This was just a little acronym that I told ChatGPT. I was like, can you help me come up with like a little acronym? So STEP, right? So we're going to use STEP to tackle any question. So that is STEM, think, eliminate, and pick, right? So I really wanted to make sure that I emphasize that it is so important to spend a minute with your STEM, right? So read it very carefully, read it twice, look for any keywords, like absolutes, look for the polarity of the question, make sure you understand whether you're looking for a right answer or a wrong answer, right? So next we're going to think, right? We are going to apply the priority frameworks in order. So ABCs, okay, there's nothing about that. Is this a Maslow's approach? Nope, nothing about Maslow's. Okay, let's look at nursing process. All right, then we're going to eliminate. So we're going to use our test taking strategies to remove any distractors if we're not sure of what the answer is, right? And then we're going to, last but not least, we're going to pick. We are going to select that best answer based on textbook knowledge and patient safety. And we're going to pick it and we're not going to change it. We're going to move on. All right, so here are our top 4 common test taking pitfalls. So these are just the things that I see most often when I meet with students. So the first one, overthinking the question. It is really, really hard for us not to add to the question. Remember, and I know this sounds a little harsh, but as a student, it is your job to answer the question, not to like critique the question. And what I mean by that is, if you're only given this much data, then that's the only data you can go on, so you can't, when you're looking at like let's go back to a question here real quick. I wanted to go to this one. So this is a good example of we could possibly add to a question, right? So which nursing intervention should always be implemented? Encourage the patient to cough and deep breathe. Yes, I should encourage every single one of my patients who is, a walkie-talkie, who can follow instructions and all of that stuff, to cough and deep breathe, right? So it's easy for me to add to this question because I can say, well, it doesn't say that the patient is intubated. Yeah, but it doesn't say that they're not intubated either, right? So a lot of times when I'm meeting with students, they'll say, oh, well, I just assumed that when, it was talking about a heart failure patient, that they also had hypertension. Well, unless it said that in your STEM, we can't make that assumption when we're trying to answer the question. So let's go back to that. All right, so just be very careful on adding to your questions. Don't do your what ifs and just go with just the facts, Jack. That is all the information you were given. Ignoring strategic words. So pay attention to words like best, first, most important, avoid, never. So look for those little clues, because remember, you are going to be answering questions where you have 4 right answers, right? Choosing the real world answer. Oh, this is so hard. This is my own downfall too, right? So I put this one on there as not only, meeting with students, but of being a victim of answering this way personally too. So it's really hard because we have to, in a way, like, and I hate to say like, oh, we're teaching to the test, but we are teaching you to pass the NCLEX, right? So we might know, because maybe we work as a, an ER tech, or, I have experience as a medic, or what other, whatever my real life experience is. I might know that the textbook says this way, but in reality, it's this way. Well, I mean, I don't want to sound insensitive, but the NCLEX doesn't care that you've been a tech in the ER for 15 years. It's going to go by, and then your textbooks are written according to that plan, right? So go with the textbook answer. Sometimes it is painful to do it, especially in, at least in my experience, in communication questions, because you're like, I would never say that to a patient. Like, that is such a weird, creepy thing to say, or, you know, something like that. But it's like, no, the textbook doesn't want you to say this. It doesn't want you, or, you know, it wants you to follow this step or to go through 100 medication rights or whatever it is. So we are not going to answer for, you know, this is how they do it in the emergency room at Banner Desert, because you're not taking the Banner Desert NCLEX. You're taking the national NCLEX, right? So be very careful not to get caught up in your own experience. It's a great thing to have your own experience, but it does make sometimes the question answering just a little bit tricky. And probably the hugest thing I see is missing the polarity of the question, especially when it's negative polarity, because as I already said, it just goes against us to answer a wrong answer as the correct answer. All right, and then last but not least, what to expect during nursing exams. Our exams are timed. You can expect anywhere from 1.5 to 2 minutes per question. So if we have a 30 question exam, you're gonna be timed at 45 minutes, right? Personally, when I have a lot of, I give you guys 2 minutes when there's math in there. So it depends on how much math, you know, we have in an exam before I could say, like, this is how much time you'll have. We do not allow backtracking. What backtracking is, you know, oh, I don't know this one, let me come back to it. Once you move on from a question, you cannot return to it. So if you don't answer that question, it'll just be marked as incorrect. So we can't skip or return to previous questions. There's going to be a mix of question types. So we are going to have a lot of multiple choice questions, select all that apply, or our SATA questions, ordered response, you know, where it's going to say the nurse is, you know, performing a, you know, a blood draw, right? A peripheral blood draw. Place the following steps in order. We don't really have, we have to be a little sneaky the way that we do that in Canvas, because the way that the questions are set up. So a lot of times we have to do it as like a matching question. So it'll say, like, you know, it'll give the step, and then over here it'll say like first or second or third or whatever, you know. Fill in the blank occasionally. What a hotspot question is let's say there was a like a picture of lungs, right? And it would say, click on the spot where the nurse would auscultate bronchovesicular lung sounds. And so you would click on that spot. Canvas does not give us the ability to do hotspot questions. So if our equivalent of that is, I would provide you with an image, it's going to have letters, you know, A, B, C, and D on it. And it's going to say, which spot would you hear bronchovesicular? And then you'll have to pick which spot is labeled A, B, C, or D. And then the case-based questions, these are kind of those, the new, like the next gen NCLEX. It'll actually present you like a little patient chart, you know, like on this page, it'll have vital signs. This page, it'll have lab values. This page will have nurses' notes, and you can actually click through the different areas of the chart, and you might answer, you know, 3, 5, 10 questions based on that patient's chart. So those are case-based questions. Again, not something that we can do super well in Canvas. We have to get a little bit creative with it, just because the quizzes functionality isn't there for it. But we do have other resources, like in your Lippincott bundle, where we can, you know, go through some of those case-based questions, specifically our clinical judgment model questions. All right, so look for that strategic wording. You know, I try to be good about remembering to bold things, but every once in a while something will squeak by me, you know. NCLEX style focus, remember it's going to be textbook and ideal world answer, not workplace answers. All questions count. So we're not going to have, unless it is noted on there, like, oh, this question is just for funsies, right? They're all going to have points associated with them. I include that on here because, like, for example, in the HESI, sometimes if they're piloting a new question type, they will have questions on there that you don't know that it's a pilot. They only know it on the back end, and it doesn't ultimately go into your score. However, for us, we're not doing that. If I put a question on the exam, it's going to count per point. One question per screen, going back to that backtracking one, and then no external aid. So we do not allow phones, notes, most of the time smartwatches too. All of that has to be put away during the exam. All right, well, hopefully this was helpful for you. I'm sure it was a lot. I hope that you paused me many times and went away and did other things. Please let me know if you have any questions or anything that I can do to help you. It is always my goal for every single one of you to pass block 1, block 2, block 3, and block 4. So if there's anything that I can do to assist you with that, please do let me know. Thank you so much.